Okay, good morning, everybody, and welcome. I'm Cali with Burrows Consulting, and we're going to dive straight into today's conversation with Adkisson Search Consultants. I'm going to hand it over to Michelle so she can introduce herself and the company.
Morning and welcome. I'm Michelle Houchin, the president of Adkisson Search. We are an executive and physician search firm. We have been in business for 23 years and we're very happy to be speaking with all of you today.
I'm Shannon McKay, the Vice President of Adkisson Search. And again, happy to be here today and here to answer any questions that you all may have.
Awesome. Yeah, we are really excited to have you today. I know Elizabeth wishes that she was here, and she'll definitely be on the next one. And so, with that, I think we'll just go ahead and get into the questions. That's what everybody's here for. So, the first question that we have is, how have provider expectations changed over the past 5 years? And how should organizations adjust their recruitment strategies accordingly?
Yes. So I think we've seen a big shift over the past 5 years in recruiting, as everybody has experienced. First of all, the need is huge, and everybody is in the process of recruiting for providers. Whether you're looking for primary care or you're looking for behavioral health, I don't think there's an organization out there right now that would tell us that they wouldn't take a primary care provider or behavioral health provider. But the difference today is that we used to be able to just focus on location and compensation. And in today's market, you're looking at the physicians who they truly want it all. They value their mental health, they value their work-life balance more than ever, and they're asking for schedules that are not your typical 5-day work week, or even in the past where physicians were basically available 7 days a week. We've now had physicians really prioritizing that work-life balance and asking us. Recently, we've had 3-day work weeks.
Yeah.
So it feels like our work days, our work weeks are getting shorter by the request of the physicians. And it all comes down again to that work-life balance, their mental health, and we're seeing it with many different clients recently. And that 3-day work week, they're asking then to work 12-hour days,
Yeah. Mm,
but they still want to make the same amount of money that they would make if they were working 5 days a week or 6 days a week. So they're still at the very high end of that compensation scale while working a lot less. So we need to be, all of us, in the organizations need to be flexible. How flexible can we be in order to meet the needs to successfully still hire physicians that we need and yet give them the lifestyle that they're looking for? So definitely outline what your flexibility looks like as an organization, and how can you meet those needs of each doctor.
yeah, that's really good. That feels like the work week is getting shorter and shorter for everybody. And I kind of love that for everybody, but then how do you work with that?
Right.
Yeah.
Yes.
Um, so the next question that we have is, what are some overlooked but effective strategies for recruiting to rural or underserved areas?
So Shannon, were you going to take that one?
Um, I can. I actually, um, when we're looking at the effective strategies, then we're really looking at, if you're looking at the rural locations, we are looking at rural training programs. And those rural training programs, we know those physicians have an interest in rural. We know that they want to be the lifestyle of a rural physician. So our focus is always to go into those rural training programs, finding out who might have a connection or a tie. We know that then they're going to be able to be involved in the community because that's what their desire has been and the reason they went into that training program in the first place. Also, in looking at the physicians for that rural lifestyle, look at the fact that you have a lower cost of living. When it comes into a rural lifestyle, we definitely target that when we're talking to physicians. We talk about the work-life balance, that you're not going to spend 20 minutes, 30 minutes, 40 minutes in traffic if you're in a major city. So you have, again, it goes back to the first question, looking at the lifestyle in a rural location are definitely good selling points. You also want to think about the fact that this physician in a rural small community, they're like the big, they're the big fish, right, in a small sea, and they have the opportunity to really make a big impact on their community. And that's, I think, for some people, that's a huge attraction, that they want to be that person. They want to be seen as the physician in their community. And that's really, I think, who we find that are interested in those rural locations, being part of a small community. They want to be involved in their patients' lives. Typically, they may be even available more by phone call. They're going to see their patients in the grocery store. So you want to make sure that the physicians you're interviewing into your small rural community, that they understand that, and that they're really looking for that lifestyle.
Something also that I would like to add to that is, I believe is completely overlooked. In the rural locations, if you're in a rural environment, it's really important to always be recruiting. You never know when a physician is going to come to you one day and say, I'm going to be leaving within the next 90 days, or give the resignation, or I'm sure that you all have staff that are coming close to retirement age. Recruitment should be ongoing all the time. And so how do you do that most cost effectively? And that would be, have your providers work for you. Do they know of anyone going into residency, family med, or general surgery? And have them start networking their friends and seeing who would be interested in your opportunity. It's getting connected in your community, and this is why it's so important in a rural environment, that being connected to your community doesn't mean just going to the Rotary meetings in your community or being out shopping in your community. It's being connected with the high schools. What students do you know that are in your community? They're going off to medical school. What a great way to really intervene early. Meet with them, ask them what are their interests, and do they plan on coming back to your community? Offer incentives to come back to your community. I mean, that is probably one of the most effective ways to recruit. We actually have a client, and it's in rural Illinois, and they have 7 primary care physicians who are all born and raised within that community, and
Oh,
they all
wow.
come back and practice, and the retention rate is phenomenal. So if you can just stay connected with the high schools, know who's going into medical school, another great way to recruit. And then, of course, not everyone wants rural medicine, and it's only like 4 to 6% of residents graduating today that want that small environment. But again, staying focused on rural residency programs, getting connected with medical schools. I mean, those who want the small rural are very impactful in their community.
Yeah. No, that's really good. Go to those Friday night football games if you're going to try to
Yeah,
recruit role.
exactly.
Yeah, that's really good. So you talked a little bit about a current client and your experience. So kind of on that, still in your experience, what's the number one reason providers accept or decline an offer after they visit?
Um, so we have found that typically by the time a physician is interviewing, we already know if they're going to, like, the goal is that you should already know if they're going to accept or decline, right? They're going to know the details of the compensation. They're going to know the details of what the full benefit package looks like. They've already done their research on the community. So now you're just in a situation to really look at, do we connect? Is the culture a good fit? Do the leaders and the providers, do they just feel like this is the place that they fit in and that they want to be long term? And then if it is, I mean, that's the goal, that we have already picked those pieces apart to know when they come on site, they're going to accept. So when they don't accept, if that happens and you have somebody interview and they decline, it typically either means the vetting from the beginning, when you're recruiting them over the phone, the vetting hasn't been good enough. so that you truly didn't dive deep into their interest, who they are, and adequately share with them who you are and what your culture is like and who you are. The other thing could be that when they come on site, that it just really isn't a good personality connection, or they didn't feel that they were a good colleague with the partner. Maybe there was something that they just didn't come in and feel that these are colleagues I want to work with every day. So you really need to be able to, we always said it's like roll out the red carpet, and the physicians and their colleagues need to be available for the interview, make them feel very welcome. You are selling to the candidate the reason to join your organization, just like they're selling themselves on why you want to hire them. And if it's not a good fit and they don't feel like they're needed and wanted and really going to be a big part of your organization and community, then we see a decline in that offer.
One other thing I just would like to add is, so your culture doesn't just speak through leadership, it speaks through everyone in your hospital or in your clinic. So whether, it's someone at the front desk, it's the lady in the gift shop, it's the RNs that are attending to the bedside, you're the candidate coming in, you're not only interviewing them, but they're interviewing you too. And they are looking for all those consistencies. And when they walk into your culture, they want to feel how they were described as your culture being. And they're going to be looking for that culture in everyone that they speak with. And that is a reflection when you find that consistency in the culture of the leadership walking the floors, the CEO walking the floors, and getting to know the staff, not only on a professional basis, but personal. So how was your night last night? I recall your son's getting ready to launch into college. And so all those things add value to your culture.
Yeah, that's really good. Shannon, you had touched on the last answer a bit on benefit package. What does a competitive benefit package need to include?
Would say a competitive benefits package. Of course, we all know compensation is important, so you're going to know that from day one when you're speaking with a candidate. Sign-on bonuses are important, relocation, stipends. What we have noticed over the past 5 years is those stipends, those sign-on bonus, the compensation has increased significantly. So no longer can you offer a stipend, for 30,000. We're looking at stipends 50,000 plus, just depending on how many years yet the physician has in residency. We're assigning physicians in residency that are PGY2 or PGY1. So those stipends have to stretch out longer, which means that the value of those stipends have to increase. The sign-on bonuses, if you have time to interview and you're constantly interviewing, you might be able to secure a provider with a $20,000 sign-on bonus. However, if we're in the midst of needing a provider right away and we need to get someone hired sooner rather than later, you're looking at a $100,000 sign-on bonus. That is crazy, I know, but this is what these candidates are accustomed to hearing. And then stipends, talk about that, flexibility, depending on who that candidate is. If you can accommodate some of their flexibility requests, that's also very important. So being flexible and creative is key to recruiting the provider that you want on your team. Starting early is key so you have time and you're not feeling pressured by not having a provider and just hiring any provider. So be early in the recruitment, make sure that you can be flexible and creative in your recruitment, but have your compensation set, have your sign-on bonus, your stipends, relocation, be ready to offer all of that. And relocation can range anywhere from 7 to 10,000. We see it very creatively amongst all of our clients. Some offer just giving the provider the check, some request getting 3 quotes. Whatever you're comfortable with is fine. Just be creative and listen to what it will take for that provider to sign the contract.
Yeah.
I don't think it's an option anymore, right, Michelle? Like people will
Right.
say, well, we don't offer relocation. Like you don't have an option to not pay for the relocation. You don't have an option to not offer a sign-on bonus anymore. Like you cannot wait for the end negotiation to say, oh, well, maybe I'll give them a little, I'll use that for negotiating. The first phone call these physicians are asking, what's the compensation? What's the sign-on bonus? And what's the relocation? And you have to have that outlined for them.
Yeah.
One other thing I'd like to add. So please know that we are very mindful of every one of our clients and their budgets and what they can afford. And we understand that, rural locations can't, don't have as much flexibility for compensation as a big healthcare system. So we really are finding those individuals that have a connection to the rural medicine and to your area. So although they're asking for big compensations and sign-on bonuses and all of that, we are asking them, you do understand what that means. If you want to make a base salary of $300,000 as a primary care physician, and that's what we're hearing, then you know how many patients you're going to need to see, depending on who you are and your payer mix will determine on how many patients they need to see to even meet the $300,000 base salary. But these salaries are going just crazy because everyone is looking for a family med. Everyone's looking for a general surgeon. Everyone's looking for a nurse practitioner. So we're all competing with the same providers. And it's really the providers are sitting there going, who wants me more? And so they're driving the cost up to recruit them, but keep them accountable. And we are very clear in saying, you know what that means. If we're offering the high salary, how many patients you're going to be seeing per day.
Yeah. Yeah, no, that's a very good point. I'm glad that you made that. Because I think it's easy to say the numbers and be like, well, this is what I'd like, this is what I'd like to,
Right.
without realizing really like on the back end, realistically, this is what that looks like. Is that the work you're willing to put in? And if
That's
so, great.
exactly right.
Like,
Yeah, it's just crazy out there. It's every day we're coaching our candidates.
yeah. Um, what are some red flags in the hiring process that should, I guess, cause an organization to like reevaluate a candidate?
Mhm. Mhm.
Really comes down to the consistency of what you see in a candidate, from are they communicating timely? Is there the things that they say consistent with what they told you yesterday in 5 days? Asking the same question over and over again in different ways to make sure that they are being honest and they're being truthful. If you feel that you start to get inconsistency of information, then that's when we start to question whether or not that candidate is really being honest and transparent with us about who they are and what their true interests are. Another area is to really pay attention to their timeline. So create a timeline going from medical school to the current day. And then when you look at, are there any gaps in their timeline? Did they, every month should be accounted for. You do not want to see a physician who has a year with that you don't know where they were. You need to ask them, during this time frame from 2000 to 2001 or from June to August or whatever that might be. If you see a gap in their history since medical school, ask them for an explanation. If they easily answer it and they tell you exactly where they've been and what they've been doing, then that's great. If they get I guess we've had candidates that probably have something in their history to where then they get upset that you're asking, like, why are you asking me that? You're asking too many questions. That's a red flag. If you're asking them questions and they are defensive and don't want to answer them, then there's a reason. So then you need to question them even more. We also will look at, by the time you start to feel those inconsistencies or maybe some red flags, when you check references, you're going to want to really touch on those points that you're questioning as well, see what their references may have to say. Again, and ask open-ended behavioral-based questions about your candidates. Don't just ask yes and no, because the references then will just answer yes and no. You really want to dive deep into those individuals in the referencing so that you can really learn and uncover who your candidate is and make sure that you know there are no everything they have shared has been honest and open within their background.
So I always say, the true colors come out in a candidate during negotiations. So we coach our candidates that you go to the table one time to negotiate. But when you have a candidate that keeps coming back to the table and asking for more and asking for one more thing, that is truly a red flag. So that displays to us when a candidate does that, they're going to be very high maintenance for you. And they're never going to be happy and they're always going to be wanting more. So you'll never be able to really suffice them. And then with that, then you question their longevity.
Yeah.
But so going back to the references, when we do check references, I always like to ask that last question, being, is there any question here that I should be asking you that I have not? And 9 times out of 10, if you get the long pause, oh man, that's another red flag. But you want to pay attention to all those because they mean something. And don't be afraid to question those pauses. We another fun saying that we have internally is, having the courage to interrogate reality. So it's really just probing deeper and deeper. Every time you feel something in your gut, ask that next question. Keep asking those questions. And to Shannon's point, that will reveal their endurance to be asked those questions, and how they respond is key. Pay attention because it speaks something.
Yeah. No, that's really good. So on the line of the candidate, how can you tell if a candidate truly is mission aligned or just saying what you want to hear?
I think Shannon touched on it. It's the timeline. It's the work history. Have they always been in role? It's their training program. Do they do a role track? Where are their family ties? What other opportunities are they looking at? Something else pay attention to. If they're all consistent in role environments, that speaks volumes, then that's truly what they want. If they're interviewing with you and then they're interviewing with the big health system in a metropolitan area, you're a little confused, right? And that authenticity of being interested in rural medicine. So paying attention to that, the timeline, the work history, the training program, where else they're looking, make sure it's consistent with your opportunity. And then always speaking with a significant other.
Yeah.
That's an important part of the whole recruiting. And also parents today, we have parents relocating with their adult professional children. So paying attention to their needs as well is going to be critical. We have lost candidates because the community parents are relocating with the provider and the community didn't offer the denomination that the parents wanted. So we lost a candidate to that, but pay attention to the parents if they're relocating. So that's another question to ask during your interview process, if parents are relocating.
Yeah, that's really good. We actually have a question from someone who has registered for this, which was what type of sign-on or relocation incentives actually move that needle. So that you kind of segued us into that very naturally, Michelle.
Okay, so standard sign-on bonus is 20,000. And we say that if you have time, if you're recruiting all the time and you know that you're going to need a provider in the future and someone just happens to show up to you and you're ready to hire them, you could probably get away with a $20,000, $30,000 sign-on bonus. If you are actively recruiting and you just started recruiting, you could probably offer 50,000 and see what happens. If you have time to wait, give yourself 6 months at $50,000 sign-on bonus. And if no one's biting at that, that's when you're going to have to really think about increasing your sign-on. You need to think about, all right, what can I do with my compensation package that raises me above all the noise out there? Is it your sign-on that you can change? If you can, be aggressive with that. If you don't have time to wait and you need to excuse me, get someone in there quickly, it will be the high sign-on bonus. Your compensation, you can always start to recruit at what you believe that a 280 offer is very competitive. Again, if that's not moving the needle, you may have to go higher. So kind of gauge it in that manner. But we strongly encourage everyone to always be recruiting and get your providers engaged and have them be referrals for you all. So you can be one step ahead of the game.
Yeah, no, that's really good. Thank you so much for just hopping on today. We've got some live viewers watching this right now through LinkedIn, and so I know that they are glad to hear from you today too. And we just really appreciate the collaboration and your time. And if there's anything else you'd like to say, I'll give the floor back to you for closing.
I just wanted to say thank you all again for being part of the discussion today. Michelle and I are available for any additional questions. You can find us on LinkedIn for Adkisson Search. We could talk for hours. It's what we do 24/7 for 23 years. And we love what we do. We know it's hard. We know a lot of people don't like it. And that's why we're here and to be able to help all of you and answer more questions that you guys may have to help you be successful in recruiting. So thank you.